More health matters here on Good Morning Namibia. Now, epilepsy is a central nervous system disorder in which brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. Now, joining us with more on epilepsy is general practitioner Dr. Shayela Makemba, who will give us more information on the disorder. Dr. Shayela, very good morning to you, and thank you so much for joining us this morning.
Very good morning to you. Thanks for once again having me on the program, and good morning to our viewers at home.
Fantastic. As I mentioned in the introduction, epilepsy is a central nervous system disorder. What are the major causes? What are the most common causes of this disorder?
Now, epilepsy by definition is basically what we call a recurrent paroxysmal disorder that affects the cerebral function. Now, what happens is that you think of your brain as a power box where your electrical activities are taking place. Now, the guys that drive this currency are called neurons. Now, when the brain produces an abnormal or haphazard, sort of neuronal activities in your brain, then you develop what we call an epilepsy. There are a few other aspects where an individual can have a seizure that might mimic an epilepsy. If somebody has, for instance, a head trauma, or we commonly see it also in children when the fevers are a little bit high, they tend to have also seizures, but are not necessarily defined as epilepsy. And, oftentimes also in mothers that are pregnant, if the blood pressure tends to be extremely high, they develop what we call preeclampsia and then also end up having some seizures. Basically, those are, in a nutshell, commonly what we see happening, leading to seizures.
In which type of, or which part of the community or society is epilepsy most prevalent?
Epilepsy, in a nutshell, does not necessarily follow a particular trend within a society. It has nothing to do with their socio-economic background. It basically is a condition that can affect anybody in a society.
In terms of treatment of epilepsy, what treatments exist?
All right. Specifically, classically, for an individual that has been diagnosed as being epileptic, what we tend to use most of the time is anti-epileptic medications. Of course, in our setting, commonly we use Epilem, which is a sodium valproate of valproic acid, and Tegretol, which is carbamazepine. What happens then, if you diagnose an individual with epilepsy, then you put them on medication. What then happens is that, the dosages is basically, adjusted, depending on how the person's response to the medication. Yeah. Sometimes you tend to put somebody on a particular dose. You start off with a lower dose. If they are not responding very well, then you draw blood to sort of check the level of the medication in their blood system. If it's below what we call therapeutic range, which means it's not able to, in fact, give us the response what we are trying to achieve, we then upgrade it a little bit, increase the dose, and then up until you come to a level where the patient is controlled and they are seizures-free, basically.
And this decreases the amount of neurons created in the brain?
Yeah, definitely. That's what it does.
Can it be entirely cured?
I wouldn't really necessarily want to use the word curable, because by far, most of the time, epilepsy is a very well-managed condition. If somebody take their medication on time and appropriately adhere to the dosage that has been prescribed by the doctor, we tend to see them, living, a life which is basically seizure-free or fit-free. But by far, most of the time, you find that if an individual stops the medication at some stage, the symptoms might recur. So curable, probably not, but very well managed, yes.
Can someone die of epilepsy or a fit?
Yeah, what happens is that, let's say somebody now is having an epileptic attack, all right? Most of the time, the epileptic attacks are quite short in terms of the duration that they happen. They last at most 5 minutes. But of course, we do have, isolated incidents where individuals develop what we call status epilepticus. For instance, if somebody now developed a fit and it continues without basically stopping, and if nothing is done, on time to sort of abort the seizures, we use the terminology in the medical fraternity, that can later lead to brain damage and eventually can cause death. Of course, depending also in an environment where an individual is getting a fit, let's say, for instance, somebody's in a swimming pool, for instance, and then all of a sudden they're having an epileptic fit, they can aspirate the water and all that can cause all kinds of damage and eventually can lead to death.
Or while driving.
Yeah.
Now, in terms of when you come across somebody having a fit, an epileptic fit, what are some of the measures that you can take?
All right. Okay. For the purpose of our viewers at home, of course, there are a whole lot of myths out there in regard to epilepsy. By far, what then tends to happen is that if somebody is having a fit and you are experiencing somebody is having a fit in front of you, just know that the fits tend to be short in terms of duration, sometimes at most 5 minutes. The idea is to stay calm, talk to the individual that is having a fit, reassure that individual, make sure that their close proximity, it's cleared of any object that can sort of cause damage to them. Yeah. If the person is standing up or they are at the risk of falling and hurting themselves, maybe lie them down or sit them down. Of course, there are also myths that people believe that if somebody is having an epileptic fit, they can easily swallow their tongue. Yeah. Well, that doesn't happen, okay? So don't try and force object into an individual's mouth. Why? Because their jaw muscles tend to stiffen sometimes during a seizure. And if you put subject in their mouth, what happens is that they can swallow the subject, the object, it can go into the wrong pipe and cause more damage. Don't attempt to feed a person during an epileptic seizure, okay? And of course, if now you see that the patient is having what we call status epilepticus, meaning the seizure is going on for a very long time, the patient is developing difficulty breathing, or like it has happened under the water, for instance, it's probably advisable to call an emergency service, like a paramedic, to sort of come on board and help you attend to such a patient.
Because I've seen it quite often where people would put even a pen or pencil in someone's mouth while they're suffering from having a fit here.
Yeah, I think that has been, of course, a common practice, but it was done, of course, from a point of really misunderstanding, and it's often layman's people that does that, because they are thinking, because remember when you have an epileptic fit, you're sort of having those jerk movements, the so-called tonic-clonic. You can smack your lips, you can bite your tongues. Yeah. Those things do happen, but if an individual is having a seizure, you're not supposed to put items or objects in their mouth. Normally, the damage that occurs, from having bitten your tongue through a seizure or an epileptic fit normally is not as bad, so you don't need to put item in their mouth at all.
Is there any comeback once the fit has commenced? Like, as someone suffering from epilepsy, for instance, is there anything I can do within that time once the fit has commenced?
Like I've said earlier, once the fit has commenced, of course, the idea is to just make the individual that is having a fit comfortable, first and foremost. Don't try and restrain the individual, because that will not stop the seizure, okay? Like I said, clear the environment, the area that is surrounding the individual, so that when they have those movements, they don't end up hurting themselves, you understand? By far, within 5 minutes of the seizure having started, most of the time it would have stopped. And if an individual is known to be epileptic, of course, we have then what we call a post-seizure phase, where the seizure has subsided, okay? Most of the time, individuals have a little recollection of what happened, okay? They can be a little bit confused. As a layman, if you are in that situation, your idea is just to make sure that this individual is comfortable. Eventually, they do come by. Then, of course, you can now start talking to them, and if need be, take them to a nearest hospital facility.
Dr. Makemba, thank you so much for joining us this morning.
Thank you very much.